good afternoon, everyone. Thanks so much for joining us for this Thursday's COVID-19 press briefing. Today, Orange County Mayor Jerry O. Demings will update us on where we stand as a county as it relates to vaccinations and testing community-wide, and provide an update on what is taking place here within Orange County government. The mayor will also present information on emergency rental assistance and discuss other very important items and issues that affect our residents and our guest. Kent Donahue, the Public Information Officer from the Florida Department of Health here in Orange County, will report on important information on COVID-19 trending and other data. Reporters have an important budget meeting with statutory time frame, so we are going to ask you please one question only so we can clear the chambers and get ready for that budget meeting. We will begin this press event with Mayor Demings. Mayor?
All right, good afternoon to all of you. Thank you for being here. I spent the last couple of days down in West Palm Beach and Palm Beach County in a meeting with the Florida Association of Counties, and during that meeting, I can tell you that there was significant concern expressed by most of the counties in Florida about the trajectory of what has occurred in Tallahassee, where local counties' home rule has been infringed upon by the legislature, and so that's something that we will be monitoring going forward collectively as Florida's Association of Counties. And so today, however, I wanted to also accentuate that it is International Day of Sign Language. And for the 158 press briefings that we've had regarding the coronavirus, we've had our partners from the International Sign Language and American Sign Language group who have assisted us in this process. And so I do applaud the efforts. They have ensured that we have been able to communicate accurately and in a timely manner with those who are hearing impaired within our community. So join me in just giving them a brief round of applause. Thank you. Now, let me also kind of move forward as we talk about how did we do this week. There's been a lot going on throughout Florida and certainly here within our local community. But we continue to host these press briefings to ensure that we are providing accurate data and that we're sharing trends and the numbers so that our community remains well informed. Earlier this week, the U.S. announced it will begin to open international travel in early November. Travelers will need to show proof of full vaccination and a negative COVID-19 test prior to boarding U.S.-bound flights. This is really good news for one of the world's #1 tourist destinations. Our domestic travel has been robust as we have been recovering from the pandemic, but our international travel had remained significantly down. So we believe that with this new development, we will see an improvement even in our local economy as others will no doubt travel here. Also, we're reminded of the destruction and the lives that have been lost due to COVID-19. On Tuesday, the country hit a grim milestone with more than 675,000 people dying from COVID-19, which means that it surpassed the estimated death toll from the 1918 Spanish flu pandemic. As for the numbers closer to home, here in Orange County, there are now 224,587 coronavirus cases reported. The number of deaths in Orange County has now reached 1,922. That is 45 new deaths since our press briefing on Monday of this week. Certainly, every one of those families who have lost a loved one, our hearts and prayers go out to those families. Those are members of our community, and we do not take lightly our responsibility to try to reduce the spread of the virus within our community and thereby save lives. The total number of deaths in August has been adjusted once again Perhaps Kent Donahue from the Department of Health will get into it, but their data shows that we now have 401 individuals who have been reported of dying from the coronavirus here within Orange County. There's some better news to share. We are continuing to see the 14-day positivity rate decline. It currently stands at 10.57%. Just 2 weeks ago, it was above 14%. And so we're trending in the right direction. You might recall that in the beginning of August, it was above 20%. So it's roughly half of what it was at the beginning of August. When it comes to vaccination rates in our community, the percentage of residents ages 12 and older who have received at least one dose of the vaccine has risen slightly. We now have 73% or so of our population that has received at least one dose of the vaccine. While this is good news, the CDC still has our area listed as an area of high transmission rate. I believe that at some point in the very near future that is going to be adjusted. But I do realize that the new protocols that are being implemented by Florida's new Surgeon General are being hotly debated throughout the state of Florida, but we need to remain vigilant on the strategies put in place to get past this pandemic. This includes increasing vaccinations and testing, wearing facial coverings, and practicing safe social distancing. We know that this works. Our Orange County employees are continuing to do their part in getting vaccinated. As of today, 84% of all Orange County employees have complied with the directive that I put in place. That includes 94% of the non-union employees and 69% of the union employees. These numbers include employees who have received one or more doses of the vaccine or who have had accommodations granted. I do appreciate our entire workforce for complying with the directives that have been put in place to keep our workforce as safe as possible, as well as keeping our citizens safe. This week, there were discussions with the International Association of Firefighters regarding the vaccine mandate. This is where we stand at this point. We are offering a cap on the disciplinary actions for those who choose not to comply with the mandate. I want to be clear here. It was never my intention to terminate anyone from our employment. Instead, my desire and goal was to increase the rate of vaccinations amongst our employees, and we have accomplished that. I very much respect the input we've heard from our employees who were fearful of losing their jobs. We advised the firefighters union that the county would discipline non-compliant employees only to the point of a written reprimand. We are a compassionate and caring employer, but we must also balance that with protecting our employees and the public. So I want to ensure those who are not in compliance that they understand that they should not be in fear of losing their jobs or their incomes in order to support their families. However, we are well within our lawful right to issue the mandate, and it still remains in place. Disciplinary actions and additional health screening measures will be implemented for those employees who have not complied with the county's vaccine policy by the deadline that has been established. I understand the important role our employees play in serving the members of our community, and that is the reason why we are making the decisions that I just announced to you. As a reminder, as we're heading into the weekend, the 3 free COVID-19 testing sites operated by our Orange County Health Services are open 7 days a week. And as we announced on Monday, these sites and the vaccination site at Camping World Stadium will remain open through the month of October. We cover information about our available testing and vaccination sites to ensure that we have clear communications with our community, so that anyone hearing this information for the first time during any of our press briefings are made aware. The 2 testing sites at Barnett Park and the former Claricona Elementary School are open every day between the hours of 9 a.m. and 5 p.m. The Econ Soccer Complex is open between the hours of 9 a.m. and 4 p.m. You can get information by going to our website at ocfl.net/testing if you need more information. To get your free vaccination, you can go to Camping World Stadium. They continue to offer the Pfizer and Moderna vaccines. It is open 7 days a week between the hours of 9 a.m. and 5 p.m. This pandemic has impacted many of our residents and the ability to pay their rent. I want our residents to know that there's help available through our county's Emergency Rental Assistance Program. To date, more than 1,663 families have qualified for help with their rent and have been able to stay in their homes. More than $9.3 million have been approved for distribution. Residents who still need assistance with rent can go to our website at ocfl.net/rental assistance to review program details and view frequently asked questions. And so lastly, before I turn it over to Kent, I'm pleased to share that we kicked off our countywide redistricting process on Monday night. This is something that Orange County government is required to do after every census in order to reconfigure and establish political boundaries for our elected officials. It is very important we have citizen input in this process, so I'm taking the liberty to share information about our redistricting efforts to ensure the public is aware of the process. There will be 11 meetings in total taking place through mid-December, with 1 meeting to be held in each of the 6 county commission districts. If you cannot attend these meetings in person, you can submit a public comment through our website at ocfl.net/redistricting. The website also has a list of upcoming meetings and other important information. The next meeting of this committee will be on Monday, September the 27th, here at the Orange County Administration Building, beginning at 6:30 p.m. And now I'm going to turn it over to Kent Donahue from the Florida Department of Health at Orange County. And I want to also let you know that today I did ask the medical director for Orange County government, Dr. Christian Zuver, to be here if there are questions related to medical expertise. Rather than me respond to those questions, I wanted people who are qualified to respond to that. So we asked our medical director, Dr. Christian Zuver, to be here. If there are questions regarding the testing or any of the things associated with that, we have our health services director here, Dr. Yolanda Martinez. And if there are further questions that may come up regarding conversations with the IAFF or any of our unions, I asked our HR director, Mr. Ricardo Day, to be here today, and we also have our Director of Public Safety, Danny Banks, here. And if we need to translate in Spanish, we have multiple people who are bilingual who are here today. I do recognize Commissioner Gomez-Cordero has joined us, but we have Ms. Ilia Torres, my special assistant, who will do translation, but Dr. Martinez is also fluent in Spanish, and she will assist in that regard. We do have representative from the school district here today, Mr. Scott Howard. If there's any questions reference to schools, we generally will ask Scott Howard to come forward to respond to school-related questions. And so with that, Kent, I'm going to turn it over to you, and then after he finishes, we'll open it up for any questions in the traditional manner that we do. All right.
Okay. Well, thank you, Mayor. Appreciate it. Good afternoon. My name is Kent Donahue. I'm the Public Information Officer for the Florida Department of Health in Orange County. I'm filling in for Dr. Pino today. Our total positive cases here in Orange County since the beginning of the pandemic are now at 224,587. The 14-day rolling percent positive average continues to go down. We're currently at 10.5. The last time the 14-day rolling percent positive was at or below 10% was this year on July 17th, and that data point was 10.37%. As Mayor mentioned, unfortunately, we've had 45 additional fatalities related to the COVID virus here in Orange County since our last news conference. Those individuals, the age group was 21 to 93 years of age, and the median age was 69. Our condolences to the families and friends. Our current total now of deaths for the virus itself here in Orange County is 1,922. Of those individuals, 22 were female, 23 were male, 8 were black, 1 was Asian, 30 were white, 6 were other, 16 were Hispanic, and 29 were non-Hispanic. Of the 45, 17 had known underlying health conditions and 28 had unknown underlying health conditions. 13 dates of death are assigned to the month of August. As the Mayor mentioned earlier, the month of August now has 401. That's our highest total we've had. The previous total for that was January of this year. That was 228. And last July of 2020, our high was at 227. So once again, August, we're at 401. There were 32 dates of death of the 45 assigned to the month of September. 45 of the deaths were associated with a long-term care residence. 9 of the 45 were fully vaccinated, and 3 of the 45 were partially vaccinated. Speaking of vaccination, there's plenty of opportunity, and we encourage you to get vaccinated here in Orange County. There's over 115 different pharmacies. As the Mayor mentioned, we have the Camping World Stadium is always operational for your needs 7 days a week. Orange County residents, the eligible population, 12 and older, with at least 1 dose of vaccine is now, as you mentioned earlier, at 73%. We continue to rise each and every day. We have continued numbers of vaccination. And finally, the eligible residents with with the vaccine series complete, that number is now at 63% of the population. So, Mayor, I'll wrap it up. It's a short one, but it's a good one. And I'll send it back to you.
All right. Thank you. We will open it up for questions now. There will be a microphone that will be moving around the room, and so I see that we will start here in the front. Ms. Lauren Seabrook.
Lauren Seabrook, Channel 9. Mayor, being that we are about 1 week out from your first deadline, I'm guessing there were probably employees who got vaccinated in fear of losing their jobs. What would you say to any employees who feel like these who have been holding out maybe are being let off the hook by only getting a written reprimand instead of losing their job?
I can't begin to get in the minds of why someone actually got vaccinated. We have continued to educate our employee on a daily basis with factual information from qualified health and medical experts. And so I believe that more than likely motivated most of those to get vaccinated. But we have no way of knowing that. We also offered incentives, monetary incentives for some of our employees to get vaccinated. Perhaps that was something that motivated some people. Perhaps what motivated some was the fear of being disciplined. But in either case, I think that the greater fear that any of our employees should have is the fear of contracting COVID-19 and possibly dying from that. So in either case, we have to put it all into perspective. And that has been the central theme of the efforts that we have put in place here in Orange County. It has always been on the preservation of human life.
Matt Trezza, Fox 35 News. Do you have any statistics that you could please share about, Mr. Mayor, about how many firefighters or what percentage of Orange County firefighters have so far gotten 1 or 2 doses of the vaccine?
Ricardo Day, is Ricardo back there? Byron, do you have the numbers? Just a moment. They still have time.
Rather than pull up the exact number, I'll say in the operations that about 50% of the firefighters in the operation area have submitted their attestation. We believe there may be more than that that have actually had their vaccination. Some may be choosing to withhold on submitting the attestation, perhaps in solidarity with some others, but we have at least, and before you end, I'll get the actual number, but it's around 50% have actually complied with the date so far in terms of submitting the attestation.
This is Melissa Thomas with Florida National News. This question is, of course, for Orange County Mayor Demings. This is more of a follow-up to our last press briefing. How are things going with kind of the Orange County team now as it relates to recent COVID-19 losses and even those who are in the hospital right now? How's the team doing?
We see fewer employees who are contracting the virus, but as I reported the first part of the week, we had another employee who unfortunately died of contracting COVID-19. On a regular basis, I get notified that a family member of one of our employees has died of the virus. I got notified of one right before I came down for this press briefing. So as we have endeavored to increase the rate of vaccination, I think that has resulted in some positives for us in terms of reducing the number of employees who are contracting the virus. So that's our goal here within Orange County. I will tell you that we continue to see, even as we had a lot of conversation about our first responders, by and large, of our employees who have contracted COVID-19, the overwhelming majority are those who are public safety officers, whether firefighters or our correctional staff members. That's where the majority of our employees who are contracting the virus work. They work in those respective areas. That probably is the area, especially within corrections, where we've seen more deaths of our employees than any other department, but we probably have a significant number of firefighters who are out right now who are positive for COVID-19. And so part of our effort here is I don't want our firefighters who are working in the field going into someone's home unknowingly, spreading the virus to the citizens that we serve. I don't want them to unknowingly spread it to their coworkers as well, who can take it home and spread it to family members or otherwise. So we are remaining focused on the goals that we have in mind. Okay.
Amanda Dukes with Channel 2. Mayor, this is for you. When you were talking about making the decision to do a letter of reprimand rather than firing for the firefighters, you also said, we feel like we've accomplished our goal, encouraging compliance. Is 50% of the firefighters being vaccinated? Was that your goal?
My goal is really comprehensive with the overall employee of Orange County government. And so when we reach 84%, that's much better than in the community at large. Of the eligible population at this point, it's about 73%. So you have heard over time, the experts have said that kind of to reach that pinnacle, if you can reach herd immunity, it needed to be the 78 to 80% of the population. So that's why I say that effectively we're there. We reached our goal. I cannot just focus on one group of employees as the Orange County mayor. My responsibility is for all of them.
Asher Wildman, Spectrum News 13. This is for kind of a two-part question for either Kent or Christian and also Scott that's here. Yesterday, Governor DeSantis said that according to a University of Oxford research, 98% of healthy individuals who are quarantined do not get coronavirus. And I was wondering, does the county have any data about students that are being quarantined, healthy or not, contracting COVID, and if the district has any of that information as well?
Scott, you got it.
As far as quarantine data, we only record those notified or issued quarantines by the Florida Department of Health in Orange County on our dashboard, and we keep a rolling active status of quarantines on the dashboard. So as those quarantines fall off, they fall off our dashboard. So we're in the process right now of looking at the way that we track those on our dashboard and what the changes in the new rule will mean moving forward and what that'll look like. So that's all we do as far as tracking that. I would certainly defer to Kent if there was other ways of looking at age groups and quarantines and contracting the virus. So, but we do track it as far as the students and employees that are quarantined on our dashboard.
Well, I couldn't speak to that directly. Certainly, one of our epidemiologists could follow up with you. So if you can send me an email, I'll certainly try to get you that answer.
Nikki Zizaza with News 6. This question is for Mayor Demings. Mayor Demings, you mentioned that they could face a written, in a form of discipline, a written reprimand. Why is it that you've taken it that far? Some may say, well, why not termination if this reaches that point of severity if people do contract COVID while on the job?
We have an established disciplinary process, and given the nature of what we're talking about today with some of the controversies or issues around getting vaccinated, we still have the responsibility of serving the public. And so when I make decisions, I make it in the context of our ability to continue to be able to adequately serve the public. And so I think, again, as an employer, I listen to, our firefighters, and we will take appropriate action. But we remain confident that the directive that we put in place was consistent with current law, and at the same time striking the balance that we need to strike to move forward. By the way, Mr. Brooks, the county administrator, just advised me that in terms of the fire department, 55% of the fire department employees in general have complied with the directive. They still have a period of time by which to complete the attestation about whether or not they have been vaccinated or not. So what he said to you earlier was we believe the numbers are actually higher than that.
Steve Hudak from the Orlando Sentinel. Mayor Demings, what do you think of the governor's selection for Surgeon General?
I think the governor made a selection that was consistent with his own ideology and beliefs. In terms of the individual he selected, I don't have an opinion about that individual or not.
This next question comes in from WFTV and Sarah. The question reads, does the mayor's decision to not fire employees who choose not to get vaccinated only apply to fire union represented employees, or is that all Orange County employees?
Our disciplinary processes and standards apply across the spectrum of all employees. Okay. It appears that that is the last question. Let me just say thank you to all of you for being here this afternoon. Thank you to Dr. Zuber and Dr. Martinez. They kind of got off lightly. They're the ones qualified to answer those, medical or healthcare questions. And I'm a crisis manager, so I can clearly answer those questions. All right. Thank you all again. Have a great weekend.